Hello and welcome to the Queen Elizabeth Patient Podcast. I'm at the Proto Building today in Gateshead and I'm pleased to introduce Karen Verrill today. She's head of Maggies in Newcastle, and I've known Karen for a long time due to a varied background in the NHS. So welcome Karen, and thank you very much for coming along today. Do you want to just start by introducing yourself and then we can talk a little bit more about Maggies and the charity work that you do?
Thanks a lot, Caroline. Thank you for inviting me. Yes, I'm Karen and I've been a qualified nurse for several decades. I'm not going to tell you how many because you can tell by the lines on my face. And I've had a very varied career and loved every single bit of every job I've ever had. I've worked in the earlier days on the wards, in hospitals, in operating theatres. I've worked in intensive care, accident emergency. I've worked in the community. I've worked for a home chemotherapy organisation. I worked in a hospice. And the job I had before I got the current job was as a secondary breast cancer specialist nurse at the Freeman Centre. I have been a specialist nurse for probably over 20 years anyway, but that was the last job. And then I moved across to Maggies, so literally across the zebra crossing from NCCC to the Maggies Centre, which opened in May 2013, so was a new build at the time. And from the job in the cancer centre, I was able to see Maggies grow, develop and watch the build. And then lo and behold, I was in there.
And I mean, it's been a great achievement for Newcastle. Obviously, a lot of our patients from Queen Elizabeth go up there to utilise a lot of the oncology facilities and the radiotherapy facilities, and feedback's always so positive about it. I remember going there with patients. We took a lot of breast cancer patients up to introduce them to the centre. And again, I think it's very much set up like home from home. Is that what they were kind of aiming for?
Yes, very definitely. And there are 26 Maggies centres now. 3 of them are abroad, and there's one in Barcelona, one in Hong Kong and one in Tokyo, and then the rest are in the UK. And they are very, very amazing buildings and meant to be completely non-clinical. So there's no signs on doors. Well, I say there's no signs on doors. There wasn't pre-COVID. We've obviously, like everybody, had to adapt. So we now do have a few signs on doors. But the original vision was and has been no signs on doors, no hand towels, no hand gels, no clocks, because we don't want people to feel they've got to watch the clock and that their time is limited in the centre. Nothing's clinical. We don't wear uniforms. So exactly as you say, Caroline, it's meant to be like a home from home. And our centre in Newcastle is absolutely beautiful. Although it's Maggies Newcastle, it is actually really Maggies North East, because as you've said, patients come across from the QE. They come from Carlisle down to North Yorkshire, up to the borders, Berwick. So we do get them from a very wide area, and we're open for anybody who's from anywhere. Sometimes we do get people who drop in who are travelling to Newcastle to see relatives, and they might live in London or Manchester, and they'll pop into the Maggies Centre if they've, been experiencing any aspect of the cancer diagnosis, whether it's them or their family and friends.
Yeah, and I think that's probably an important point to say as well. It's not just for patients, it's for anybody that is affected by cancer as well. So Karen, do you want to describe a little bit more about the environment? It is beautiful, and like you say, when you go in, it's just so non-clinical, but also about the team that you work with. You've got a lot of experts, I believe, that work for the centre.
We do, yeah, and I can talk about what we're there for in the team, but I really would, it's probably not fair to mention that until I mention how it all came about. And it was the vision of a lady who had breast cancer in 1988. Her name, not surprisingly, was Maggie. And she had all of the treatment, as people do, and thought she was going to go on and, live her life. And I have to say that was many years ago. Things have changed. We've got a lot more available treatments now. But very sadly, Maggie was diagnosed with secondary breast cancer 5 years later, and was told in a very cold clinical room without support after being told that she didn't have much longer left to live. And of course, we've moved on a lot than 25 years ago. But she found herself out on a corridor after being given a terminal diagnosis. And it was because of that she decided, had a vision and wrote a blueprint for the very first Maggies Centre. And it was that it would be a cancer support centre based on the grounds of an existing NHS cancer centre, so it could be there to help complement the extremely good treatment and care that goes on in the hospitals, but would be there to complement that and in addition almost. So we feel like we're a little annex to the Freeman Hospital, but as I said, are there for everybody from around the region. And it was going to be staffed by professionals. So what typically a Maggies centre would have, and we have in Newcastle, is a centre head who is a specialist nurse by background, me, and then we have 2 psychologists in Newcastle, both excellent professionals. We have cancer support specialists. At the minute we have 1, and she is also an oncology nurse by background, and we will be hopefully at some point, recruiting more staff, but because of COVID and restrictions and lack of funds, unfortunately we had to lose a couple of members of the team, which is very sad.
And the funding for Maggies, Karen, can you tell us a little bit about that and how you keep going?
Yeah, we are a charity, so we rely on voluntary donations and fundraising activities. So like all of the charities, we've taken a hit because of COVID, and we were unable to do events. And the Great North Run is a great money raiser for us, and we do our own culture crawl walk through the city of Newcastle in the evening, and that lots of the visitors who use the centre and support us will do a walk which is sponsored. So we've lost quite a bit of funding, but Caroline, the population of people in our area, our region, are so generous, and we're not the most affluent part of the country, but I'm often bowled over by the support we get from local people. And what we've found since restrictions kicked in, small families, couples, individuals doing virtual events for us, raising money in very different ways to normal, but we have had such support from the local community. It's quite, I feel quite emotional when I talk about how much people have contributed to us, but we find when they've used the centre, they have a love for it, like I do, and want to give back when they've used it.
So you've had to really diversify everything with regards to the charities, haven't you, really?
We have, yes. It's been a struggle, and we didn't actually know how we were going to do, but, we're optimistic and feel that we're moving forward into this year and things are looking up for everybody, hopefully, with regards to getting out of lockdown and restrictions. And hopefully we'll continue as we are, but we're doing all right.
And I think, like you say, it's, a lot of the population that we live in, the close-knit families, and like you say, the way, it was 200,000 people have utilised Maggies. Amazing numbers. Everybody that's kind of touched upon will want to give something back sometimes, they feel that. And that's very infectious as well.
It's like a huge family. And I think it's helped by the environment, the informality, and as you said, home from home. So people feel they're part of the community. So many people will come in and say, "Oh, I wish I could live here." To which I often say, I practically do. But it's an amazing place to be.
I always remember that table when I walked in, that big long table, which was very much like the hub of the home, basically, and like you say, you just encourage people, because I think that's possibly one of the hardships that people have experienced, especially with cancer, is that isolation. And have you seen that, for your own eyes and ears, with patients coming through and maybe some of the phone calls?
Very much so. With regards to the table, that was another one of Maggie's visions, that she felt the kitchen table was kind of the heart of the home. And she said each centre should have a kitchen table where people could sit round, because she would sit round after a meal. And I think we do, don't we? When you talk to your family after your meal. So she wanted every centre to have a kitchen table. So we have the big kitchen table. And pre-lockdown, that kitchen table was always full. People would come into the kitchen, help themselves to tea and coffee, whatever we had on the go. There's often homemade cakes and scones, and sit down around the table and not only get the support from the team in the centre, but get peer support. And it was quite often it would be with somebody they'd never met before. They just find themselves across the table to them. Hello, how are you doing? And they would strike up a conversation and get to know each other. And the number of times I've seen people come in as complete strangers and go out with a new friend who really understands what they're going through, because whether they're the person with the diagnosis, whether they're the friends or the family, they're all in it together. And it's, as you know yourself from the work you do, it's the cancer community that come into Maggie's and because of the relaxing environment, people share more than I've ever seen in any of the clinical jobs I've ever had and in any of the specialist nurse jobs I've had.
And although I think a lot of patients, the families are very, very supportive, there's also probably your experience, and some of the experience I've seen is that often patients feel like they sometimes don't want to burden them with some of their worries and some of their stresses, and that's probably one of the positives of having something like a kitchen table. Like you say, when strangers are coming in, they can kind of unleash that kind of stress onto a stranger who knows exactly how they feel, and like I say, and then you mentioned there you've got your professionals as well, so so if there was a patient struggling mentally, Karen, and obviously you've got the peer support there, but if they just needed that little bit extra, how would they go about that?
Well, how they go about it is, first of all, in Maggie's, you don't need a referral, so nobody needs to be referred by anybody from the medical team. They can just walk in, and we often find people do walk in crisis. They don't know what they're coming to necessarily. They'll walk in the door, very nervous, burst into tears sometimes, but often will go out laughing after they've had a conversation with whoever might pick them up at the door. When I was mentioning earlier on about having 2 specialist nurses at the minute, me being one of them, and 2 psychologists, we're kind of diversified before we got to the benefits advisor. And I must mention our benefits advisor as well, because she does an absolutely brilliant job, as do all the team. And she can help people apply for benefits, grants. She makes applications on their behalf. She can, help them with personal independence payment, all kinds of things. And if anybody's struggling or got worries about finances and they're suffering from cancer, or they're a relative, please come in and get some advice and support. And even if you don't think you're entitled to anything, or you don't want to claim, and I'll put this in inverted commas, a benefit, they're not benefits, they're entitlements. And even if you don't think you're entitled to anything, she will work through it with you. And it's amazing what she finds out you are entitled to. And financial worries can be so devastating when you've also got all the effects of treatment, the worry of cancer. Am I going to be cured? Am I not going to be cured? Am I going to live with this for a long time? Am I not going to live with this? So to be burdened financially as well is even more devastating. So for anybody to come in, if anybody's suffering psychologically and needs help, how it works is you can be referred, and a lot of the doctors and nurses send people to us. People also find out about us by sitting in radiotherapy or in other clinics, and somebody will say, oh, have you been to Maggie's? Oh, what's Maggie's? Oh, get across the road, it's lovely over there. So they find out from other people in waiting rooms, but they can also just walk in, ring up, self-refer. And what would happen is they would come in, first visit, don't know much about Maggie's, and one of the volunteers, now we have a very small team of volunteers now because of restrictions, but we used to have more. But because of restrictions and less people coming through because of social distancing, because we manage that very carefully, we don't need as many volunteers. So the likelihood is they'll meet one of the nurses, either me or Debbie. And we almost do a triage with them. So we'll welcome them firstly, get the kettle on, get them in a lovely comfortable space, and then have a chat to them and find out very informally what they came for, what we can do to help. And quite often people come in thinking they need to see a psychologist, and after they've chatted to one of the nurses, we've answered questions that they didn't know were worrying them, given them information. They might have questions about side effects of treatment, or anything to do with medical concerns that they haven't necessarily retained when they've been in the hospital because it's so stressful. So we can answer those questions. If we need to get in touch with their teams as well, with the consent of the patient or the relative, of course we will. So we'll have a very close working relationship with all the NHS people, and we'll work out what they need. So it might be that somebody comes in, they have a chat to the nurses, we'll answer some questions, they feel much better, they feel more relaxed, they know about us, and they don't need anything else. Or they might need to see a psychologist for more structured support to do with coping strategies, how to deal with what's happening to them in a more structured way, and to help them work through it over a period of weeks, months, however long it's going to take. Or they might need the benefits advisor. And then on top of that, we also have quite a big programme of support. So we have various courses, support groups. So for instance, at the minute, we've now got back on the stress management course, which is run by the psychologists, as is the mindfulness course. We've adapted to the pandemic by now putting on a new Living with Uncertainty course, because we've all been living with uncertainty since March of last year, if not slightly before. We know people with cancer were living with uncertainty anyway, and their uncertainty has increased hugely. So Living with Uncertainty's on there. We have an exercise boot camp. We used to have Tai Chi and yoga, but that's still suspended at the minute because we don't really want people running around breathing heavily in the centre and coughing and choking. And the boot camp is outside on the roof garden because we've got 2 beautiful roof gardens.
Yeah, because the gardens are amazing.
Fabulous. Yeah, beautiful at the minute. We've got all the lovely orange tulips out, which just are almost our trademark. And orange is a Maggie's colour, of course. We have various different support groups. We also have a Where Now course, which is for when people come to the end of their treatment. And you'll know yourself, Caroline, they're often like a rabbit in the headlights. Oh my God, it's all over. Where do I go now? And it's a 6-week course that's run by me and the psychologist to help them with all aspects of the end of treatment low. And, you know, people think, oh, I finished my treatment, I'm going to be all right now. But that's when it sometimes hits them.
It's anticipation. I think the wait, don't they have all of that treatment, and like you say, it's sometimes like looking up the nose of a mountain sometimes when they get to that end bit, and it's like, oh my God, where now? And you see, we're so lucky to have, you know, somewhere like Maggie's to kind of give them that structured programme. Yes. How would somebody be able to access that kind of course, Karen?
They could ring up and ask to be put on.
You've got a website?
We've got a website. We do quite a bit on Facebook. Our fundraising team put lots of things out on Facebook. And you can ring the centre. People at the minute can have face-to-face appointments or telephone appointments, or we'll have some Zoom things still going on. But I have to say, during the strictest lockdown, most of what we did was virtual, although we were still open. The doors were open for people by appointment. But we've found people want face-to-face in this area. And again, I think it's because of the friendliness of the population.
And I think we've been so stuck, you know, like you say, behind screens, and, you know, that, like I said, the amount of patients that are going through the treatments and the worry, you know, in isolation, an available facility there to see somebody face to face, it's going to be the one that they choose.
And, you know, Caroline, sometimes people come in for nothing, and that's also fine. So if they're over in the hospital, obviously they can't be in any hospital and just nip over for a cuppa, but they're still welcome to come in for nothing wherever they are. And people just sometimes come in for a bit of headspace, just to sit in a different environment, look at the garden, stare into space, or talk to one of the team. But they don't need to come in feeling they're under any pressure to do anything. Nobody needs to join in any of the courses or support groups if they don't want to. They don't have to talk to any of the team if they don't want to. And it's a bespoke service for what they want. And it's almost like the triage is a holistic needs assessment. We work out what they want and pull together a package for them. Or we also say, this person doesn't want anything other than to be. They can get a nice cup of tea and just, you know, be there. People who have any delays with treatment, who are actually in the Freeman, come across and just spend time waiting, and that's also fine. And if anyone's having a bone scan and they get the contrast injected, then they've got to wait for the scan. They might as well come into Maggie's. Because it's so homely, they're not sitting on hardback chairs either. People often get their feet up, they lie around the centre. You can see people sitting sometimes in tears in an open area, but nobody looks because it's there to use for whatever they want. We also have people coming over from the wards to visit their families. Just when I left earlier on to come here, there was a lady who's been in hospital since December and hasn't been able to have visitors because of restrictions. So she's now seeing a family in Maggie's. We've got them all socially distanced in the big room, and there was 3 children and about 5 other adults, and it was just lovely to see them all enjoying each other's company again. So we're here for ward patients as well.
And I suppose they're getting that, you know, again, it's not just patients, it's the people around, you know, just that support there. And like you say, sometimes they don't even sometimes think they need that support, but sometimes dipping their toe into a facility like Maggie's, it's like, oh God, I didn't know that was available, or, you know, I'd never really thought about it like that. So again, sometimes it just opens that sort of the conversations.
Yes.
You know, and that maybe again, I would imagine environment that you've created opens up these conversations where sometimes it's a bit in hospital and hospital wards, it's difficult to have those kind of really emotional conversations, and I suppose you are there to facilitate those kind of conversations as well.
Yeah, we are, and having been a clinical nurse specialist for many years and worked in hospital environments, and in the community, in clinics, we know as nurses, patients do share things with us, but we tended to focus on the patient, and that's what happens in the hospitals because they're the ones who are being done to. But I've found since I've worked in Maggie's, people share even more because of the environment, and they feel more relaxed to talk to you. And because we're not wearing a uniform, the barrier's not there. So it's quite sometimes overwhelming how much people share. And in all of the jobs I've ever done, in all of my decades that I've not confirmed, I have never enjoyed a job as much as I have this one because of the personal interactions, what people share, and what you can do from a Maggies Centre and the relationship you build up with people.
I think, as nurses coming from that environment as well, sometimes it can be a little bit of a medical model. We are very much focused on the disease, and although we try and do our best to look at the person, sometimes it just takes that environment to kind of look at other things, because it's not just people are diagnosed with cancer, but like you say, they've got other things going on in their lives, and sometimes that can just be the straw that breaks the camel's back.
That's right, yeah. And, as I said, the teams in the hospital do a marvellous job, and it's great that we've now, we've got a Maggies Centre and the excellent NHS facilities that we've got. But it is true that just they relax into the centre and then give more of themselves. And when you mentioned families as well, what we sometimes find is families will come in and they're all trying to protect each other. Oh, no, I'm all right. And you might look at a family of 4 and they're all saying they're all right. It's the person with the diagnosis they're worried about. The person with the diagnosis is worried about the family members. And whilst they're all saying, no, we're fine, you can see each of them filling up. They're all struggling, but they're all trying to protect each other. And so the family members can be seen separately to the person with the diagnosis of cancer, so they can truly open up as well and feel that there's the support there for them as well as for their relative, which can help them all get through, the most difficult time that they're having. And during the pandemic, the isolation we have been hearing about, and I'm sure you have as well, has been unprecedented for me. I have never heard such extreme psychological distress as I have as the pandemic has unfolded from these, the people and their families. And it's been quite unbelievable. And it's been the usual upset, worries and concerns of cancer, which is huge. But all of the associated restrictions, having children at home. So parents with cancer weren't able to let their guard down. So the kids weren't going to school. The parents are sitting there worrying about the cancer diagnosis, not able to cry with each other. Obviously they did, but they were trying very hard to protect their kids. And so it was very difficult for parents to open up and let off steam, which they may have done when the children would have been at school. And just this, everybody protects their children, don't they? And for children at home, seeing their parents unwell more than they would have because they would have been at school, children missing their friends, parents missing the extended family support, not being able to have grandparents to have them for sleepovers, children not going to their friends for sleepovers. So the impact of it has been absolutely huge. And, we've all heard about delayed diagnosis, people being afraid to go to the hospital, treatments that had to be cancelled or suspended, which last year everybody was in the dark completely. So, the NHS, the government, everybody did what they thought was for the best. But it has taken a huge toll on many people with other existing problems, i.e. illnesses. And hopefully we're coming out of it. But we do know there's going to be quite a bit of fallout from people who have had further problems because of the problems of coronavirus. And I'm not taking away anything from all the poor souls who've had coronavirus and those who've died from it in their family, because that's devastating. But we've still got a lot of issues to address now with the families who have been affected by cancer before lockdown and during. And hopefully, the teams in the region, as always, will, step up to the plate and help the people. But I think the message is we're all here for them. Yeah. all of us, and all they've got to do is just make the call or get in touch with your team, whoever they may be, or give Maggie's a ring and we'll direct you back to your team. You know, we're all in it to help them.
And Karen, obviously you do a marvellous job, and like I say, we are expecting, you know, more people to come forward. I think they're getting confidence now to think, you know, environments like yourself and hospitals are safer, you know. But obviously the charities have taken a massive hit with COVID, and people, you know, generating charitable funds for you. If somebody wanted to do something, you know, that life is starting again a little bit normal, they do some amazing ideas of raising funds. The website for Maggies, is that just Google Maggies and that'll just come straight up and the website will be there? And can people see whereabouts, you know, what charity runs or different aspects of raising money for?
Yeah, they can get onto the website. Facebook has a lot of fundraising stuff on there, Maggie's Facebook page, and it's Maggies Newcastle, but there's also the National Maggies one as well. But I would urge them to give it to Newcastle if they're going to give anything. Forgive me, to the central
pot. There's a specific...
There is, yeah. There's a National Maggies pot, but there's also a Newcastle one. And we all have to raise our own individual funds. So we have to raise money for the running of Maggies Newcastle every year, and we have quite a bit to raise for that, same as we had to raise money for the build. Not me specifically, because I was a nurse in the hospital at the time, but each region raises its own money for its own Maggies Centre, and then we have to manage our own accounts. But there's also an email, so the Newcastle at maggiescentres.org email address, you can get on there, and that's generic. And we also have, apart from the programme team, we have two incredible fundraisers they don't actually do the fundraising, but they're there to support events. So Marissa's our centre fundraising manager and Jess is our centre fundraiser, and they're there to support anybody who wants to organise an event, take part in one of our events, has any ideas that they might want to run by them. Even, you know, wacky ideas are brilliant. Sometimes the wackier the better. And what we find is people who've been through a difficult time often get a lot of pleasure out of doing an event, because it then they're on the recovery. It takes them past, you know, the difficulties, and it's a fun thing to do. And they're all often amazed by the support they get from their friends and family when it comes to raising money. So, you know, get in touch by phone, by email, on the website, walk in, just, you know, come and find us.
That's great. And like you say, you mentioned a lot of great things that's happening with the programme as well, a lot of the health and well-being and the psychology input and things like that. Would people be able to find a timetable on that website as well, if days of when these different activities are on, Karen?
Yes, there's a programme on the website. I have to say, and I'm not very digitally minded, we don't do the website at the minute. It's done centrally. So sometimes it's not exactly as it's happening. So if anybody gets on the website and has a look and thinks they fancy trying something that's going on, by all means ring the centre and check that the website's right, or ring and ask for a programme to be emailed to them, because the programme also changes. We're adding things all the time. We do have, well, we used to run Living with and Beyond prostate cancer course, Living with secondary breast cancer course, gynae cancers, etc. Paused that because of lockdown, but they're all starting up again as well, but they're not yet on the programme. And Look Good, Feel Better was also a weekly event in Maggie's, but that had to pause. That's the skincare, bit of a makeover and a beautiful goodie bag. And that's the only thing we do that is only for the person who actually has had the diagnosis of cancer, because of the gorgeous goodie bag. And it's to show people how to pencil their eyebrows on and, you know, skincare during treatment. So that's not on yet. But all of these things will be being added as time goes on, but we've got quite a lot on at the minute.
So check the website out. If you're unsure, just to give a ring, and the telephone number will be on that website as well.
Yes.
That's absolutely marvellous. So Karen, is there any other aspects of the programme you'd like to talk about that Maggie's offers?
Yeah, really, it wouldn't be fair not to mention the bereavement support that we offer. And whilst, because of, you know, advances in treatment and so on, many more people are cured from cancer, of course, some people are not going to survive, very, very sadly. So we have bereavement support, and it's most of it's delivered by the psychologists. So people can get one-to-one bereavement support from the psychologists, and that's for maybe weeks, months, however long, you know, the feel that they need it for, and however long the psychologist thinks it's helping them. But we don't then say, well, you don't need that anymore. They're then offered the opportunity to join the bereavement course, which is a 6-week structured course, again run by the psychologists. And then at the end of that, there is still support should they need it in the form of the bereavement support group. And that is a group of people who have been through bereavement and also been through some of the other activities to help them with bereavement. So they're in a place where they can sit more informally in a group and talk about their relatives, but get help still from the psychologist.
Such a good service and a very, very important service. Like I say, often the focus can just be on the patient that's maybe going through it and the families, but unfortunately, like you say, the bereavement service is something that is such an important aspect of cancer care. So it's great that family members have got access to this service. So Karen, can you tell us a little bit more about family support at Maggies?
Yes, I can, Caroline. As I said, we support individuals, we support families, we support people with grown-up children, people with younger children. All age groups come into Maggies. And in fact, just as I was leaving, there was a lovely family using the centre who the lady's been in hospital since December, and because of the restrictions, she hasn't been able to see her family. And it's actually their second visit to the centre. They came last week and this week by appointment, arranged as well with the ward, obviously, because she's still an inpatient. And there's her 2 children are there, just young children, her nephew, few adults and her. They're all in the big room, socially distanced, but seeing each other for the second time, since December. And it was just amazing to see that they can get across now, use the centre and just spend time together, because as we've touched on, the isolation has been terrible for people. It's been awful for people living on their own, but also families have felt the isolation.
And I think it's even, just phone calls and ringing into the unit. It's been very, very difficult to kind of get that, of how are they, like you say, you can ring people on a phone, but it's never the same as what it is face to face. So, again, just to facilitate that, I can imagine it'd be quite emotional as well.
Very. And I think it's been emotional for the staff in the hospitals, because they haven't been able to let people have visitors. So they've seen, the distress in the hospital. And when I think we're, lucky in a way, because when the families can come to Maggie's and we see the absolute joy and the love, it's just, for us, it's just wow. And you really do, do a big swallow, but it's so rewarding to see. And during lockdown, when it all just began, we had another lovely family in. Some people may have seen it on Children in Need, but it was a young lady who was very close to the end of life, and she was an inpatient in the hospital, and her 6-year-old daughter obviously couldn't visit her because this was right at the beginning of lockdown. And her husband also couldn't go because he was looking after the little girl who was 6, and we were able to facilitate a couple of visits for this young family to come to Maggie's. So the lady came across, one of the nurses brought her, left her with us in Maggie's. Left her with me actually, because it was a weekend and we're closed. So I went in, and her husband and daughter came, and they had such a lovely time at the most difficult time. And, as a mother, it's difficult to watch, but they had just a wonderful time. And the little girl danced for her mum. She drew pictures for her. She sat on her knee. They had lovely, very close time together. And there was nobody else in the centre. I was just busy doing my admin work and keeping a check on them. And then they came back again 2 days later. And that was a very special time for them. And I was able to record the video of the little girl dancing for her mum. So she'll have that in the years to come.
Those memories.
Oh, so special. And very sadly, the mum did pass away several days later. But the family are so glad to have had that time. So, that was another lockdown experience. But prior to lockdown, we had many families coming in. And I'll always remember a lovely lady who was a mother of 4, probably, I think she was about 45 at the time. And her second youngest was about to start school. And the lady's name's Rebecca. She won't mind me saying her name because she's, had photographs taken and been publicised exactly what happened herself, because she was so glad of it. And Rebecca told me in the centre that she was really upset because her daughter was going to be starting school. She felt she should be at home to get her ready for school, take her to school. But because she was on treatment, that was very important to her at the time. She wasn't able to do that. And her date for treatment couldn't be changed because it was important that it was done on that day. I knew she was in all day. So I said, well, how about we talk to the team in the hospital and ask if you can be unhooked from your drip at lunchtime, get your sister to bring your daughter to Maggie's. I'll do a little picnic for her and you can get her ready in the centre. And then I know you won't be able to take her to school, but at least your sister will, but you'll have spent that time with her. She was absolutely bowled over and said, oh, I hadn't even thought of that. That is wonderful. So sure enough, Rebecca came over from actually the Sir Bobby Robson unit, and her daughter and sister came. Her sister just left and left them to it. So I gave them a lovely room to sit in. Rebecca got the little girl dressed in her uniform, plaited her hair. They had the picture taken in the garden. I'd arranged a picnic. They had a picnic on the roof garden, just the two of them. And that was another special time that I couldn't have done in a hospital environment, but also couldn't have done without the cooperation of the hospital team to let her come across. So she was thrilled and went back to have her treatment, and her little girl went to school. And so, family support is also what we're about.
And like I say, these are just memories that you would never have been to create in that kind of maybe hospital environment. But, the fact that Maggies and the NHS work so closely together and complement each other, I suppose, as well. And it's a great base. And for so many people to utilise, I just hope, you become stronger and stronger. And certainly the passion that you have for Maggies, certainly shines through. So all the best for the future, Karen, and thank you for coming today.
And thank you very much for this opportunity, because it's been great to talk about it. And, it's, as people know, it's me baby. Thank you, Caroline.
It certainly is. Oh, thanks very much, Karen.